So before I introduce the main speaker here, I had the pleasure of sitting outside with some of your musicians that you have here today. So I don't want to date myself, but I'm going to talk about 40 years ago when I was in my early 20s. I had the pleasure, you know, when young people used to go to dance clubs and all those types of things back then? Well, the band you have playing here today used to be called Down East. So if they, can Donnie come out? So this man, Donnie, at the time had a nightclub in Oxford called Castle's Keep. And so it's actually funny, about a week ago, you know how you get older, you sit and you reminisce about what you did when you were younger? So a bunch of us who are now in our 60s, we're talking about what do young people do today? And we had no idea. And we started talking about all the places that we used to go to. And then we actually brought up, and it's kind of funny, you know, you talk about something and then you'll see someone that, or the person you were talking about that appears. So we were just talking about Donnie and the music and everything, and now we're here today. I can tell you the music that they play is exceptional. And so I hope you enjoy it today. And again, it's just nice seeing people that you've met earlier in your life. And so I hope you enjoy today the music from Down East. But so good luck, Donnie. Thank you for coming here and playing for the seniors. And thank you, Suki, for getting them here. But other than that, my main function today is really to introduce your main speaker, who's someone that just came on with the Haley Driscoll administration, and I got a nice little bio here about her. So it's an honor to introduce the Secretary of the Massachusetts Executive Office of Elder Affairs, Dr. Elizabeth Chen. First appointed to the position in 2019, she oversees the department that funds the community-based services for Massachusetts seniors, including in-home supportive care, nutrition programs, protective services, supportive housing, long-term care, counseling, dementia support services, and so much more underneath the Department of Elder Affairs. So it's my honor today to present Secretary Chen, and thank you for being here today. And I hope you all enjoy the cake that you're going to be having today. I can't stay that much longer, but nice seeing everyone, and sorry the weather wasn't conducive to this, but great seeing all of you, and Secretary Chen.
Thank you. Thank you very much. So it is so great to be here. I have a mic here. Thank you. But Senator, before you leave, I understand it's your birthday today. I think we need to sing. Don't you think we need to sing? All right. Happy birthday to you. Happy birthday to you. Happy birthday, dear tomorrow. Happy birthday to you. Woo-hoo! That's great.
Thank you. As with all the birthday wishes I've been getting today, I've been telling everyone I've had so many, I'm forgetting how old I am now. But thank you very much. All right, let's guess and be nice. I told you, 61 today. So thank you.
That's great. That's great. Well, thank you. Thank you all for being here today. I am so excited to be here with you, and I'm so excited to have come out Amy. Oops. I think we're getting some feedback. I want to give a shout out to Amy Waters here. She is incredible, incredible. And what she has built here for everyone, the programming, the liveliness that I have seen in the first 15 minutes is amazing. This is, I would say, among the best senior centers I have visited across the state. So thank you. And thank you all. Thank you all for what you do every day, for coming to participate. Thank you, Amy, and your various volunteers and the staff here. It is amazing. And so I thought what I would do today is share with you some background about what we do at the Executive Office of Elder Affairs. More often than not, when I talk about the services we provide, the reaction I get is, wow, how do we get in touch with you? And at the end, I will tell you how to do that. All right? So let me go through some background, and also if you have questions at the end, absolutely raise your hand. I'm more than happy to answer questions. And I just also want to give a shout out to the Chinese community sitting in the back. I'm an immigrant. I came from Taiwan when I was 7 years old. English is my second language, and my parents brought, 5 children, all girls, to this country. And my father was a waiter in Chinatown. My mother was a key punch operator. And so I am so glad that you are so welcoming to immigrants to this community and to your activities there. So, all right. Massachusetts is aging, which is a good thing. By 2030, in this country, there will be 72 million adults over age 65 in the US. So that's about 1 in 5 people. So when we go out to the malls, when we walk around, 1 in 5 of us are over 65. And this is a map of Massachusetts where you see that the red parts are where most of our older people are living. And so, interestingly, you're living in an area where it's much more of mixed ages. And you have lots of younger folks in addition to older folks. So here it is, the Worcester community profile. You have about 183 people in Worcester County, and about 33,000 are over 60. So that's about, less than 20%. And the Executive Office of Elder Affairs considers that people who are over the age of 60 as our constituents, as well as the caregivers for older people. And there are about 1 million older caregivers in the state. So, importantly, there are a lot of people here in Worcester County, older people who are living alone. And that's why a senior center, a community center like this, is so, so important. It gets you out from your apartment where you're by yourself. I don't think it's healthy to eat by yourself all day long, every day. So you can come and be in the company of other people, even if you're not talking to anybody at the table. It is beneficial to be seen, to be out, and to be together with others. So you have lots of veterans. Over 15% are veterans in Worcester County. And almost a quarter of those age 65 living in Worcester County use a language other than English at home. And I saw the Spanish-speaking group, and of course in the back we have the Chinese-speaking group. And so over 90% had a physical checkup last year. Good for you. That is one of the primary things that we need to do. Make sure you have a primary care doctor, and make sure you go and visit every single year for your well visits. Is that better? Is this better? Easier? Okay, easier. All right, I will use this one. So in the blue are 2 things that I think should come to your attention. 20% of people age 60 meet the CDC recommendations for exercise. I saw a great, great room. And I know you have a beautiful studio upstairs. And I encourage everyone, you and your friends, to take advantage of it. And also 20% have a diagnosed hearing impairment. Now we know a lot more people have a hearing impairment, and I want to talk to you a little bit about why it's important to think about and take care of that. So, I have a challenge, New Year's resolution for everyone, I hope. Keep moving. Keep moving. Keep staying on your feet and keep moving. For your heart and lungs, this is CDC recommendations. For your heart and lungs, the CDC recommends 150 minutes per week. That's 5 sessions of 30 minutes. So when we think about that, when I first drafted this slide, I thought, oh my goodness, do I do this? It's hard. It's hard to get in 150 minutes. You have to be very intentional. And I encourage you to do that. In addition, this is and, this is not or. In addition, you need muscle strengthening 2 days a week. Muscle strength, I saw weights. I take a weights class, and it is really important. It's amazing how quickly we lose muscle mass. I just turned 60 this year, and I feel it. And my husband is turning 81, and I'm on his back. I'm like, you gotta get out to exercise. You have to go to exercise class, and we have to do weights. And then balance. It's important to do heel-to-toe walking, and it's important to learn to walk backwards, where the reason, there's a technical term for it, it's called proprioception, but you don't need to think about that word. It's just important. It's important to do the side to side. This is all really important. And every once in a while, stand on one leg, and then while you're at it, try to close your eyes. All of that is important. To connect, it's to connect your brain to your body. That's the reason why we do the balance. So that when it's slippery out there, and your body feels your brain and body will act together. So, my advice, please, New Year's resolution, keep moving and try to stick to this piece on the left. Now, on the right is hearing. So why is hearing important? Loss of hearing, and as we get older, we all lose some hearing. That is just a fact of biology. And it leads to increasing isolation. And again, I've talked about this before. It's really important to try not to be isolated. And hearing aids will help. Hearing aids are now available over the counter, so you don't need a prescription. You can buy them and try them out, and they will help. They will help to continue to keep you engaged with the conversations, keep you engaged with other activities that are happening. And I saw this with my mother, who, when she died at age 96, was functionally deaf, and her primary language was Chinese. And she, over the course of almost 20 years, continued to withdraw a little bit away from life because she had a difficult time hearing. And she said, I don't want to go because I don't know what people are saying, or I don't want to go because I don't want to say the wrong thing. I don't want to misinterpret what people have said and say the wrong thing. And so I encourage you to get used to the hearing aids as soon as possible, because then you acclimate and your brain gets used to using it. All right. So more about my work and the agency's work. The agency was established in state law in 1971, the year I came to this country as a little girl. So maybe this was all in the cards somewhere. We are the designated state agency for receiving federal funding. And the federal funding comes from the Older Americans Act. And that's about $100 million per year that comes to our state. And we're among the most generous in the US in providing a match, a federal match. And we provide, our state legislature provides $700 million a year in addition to the $100 million. There are many states where all they have is the $100 million. And when you divide the $100 million by 1.7 million people, that's not a lot of money. So we are very fortunate to live in a state where our legislature is very, very generous and values older people and values community, living in the community. There are other state policies and funds that are specifically benefit older adults. For example, transportation. There's a circuit breaker tax credit, and of course, subsidized housing. Those are under different agency heads and different secretariats, but as a state government, we are all very, very committed to older people. So, I've said before, 1.7 million older people in the state, in Massachusetts, and there are nearly 1 million informal caregivers. We tend to not think about our caregiving role, but if you are providing regular help to somebody, let's say once a week grocery shopping, and you're a family member, you're a family caregiver. If you are regularly paying bills for somebody, taking care of a task like that, a household task, you are a regular family caregiver. And I was a caregiver for my mother, and we tend to also talk about caregiving in negative terms. But when I talk about caregiving, I want people to aspire to be a caregiver one day, because there are moments of joy and connection with the person you're taking care of that are unanticipated. And also, there is personal growth that comes through the experience, just like parenting, that are unexpected and really, really deeply, deeply personal and important to all of us. So I know for all of you, there are caregivers in your lives. So where do we fit? We sit, Executive Office of Elder Affairs sits inside the Department of Health and Human Services. And the Department of Health and Human Services is one of a number of secretaries around the table with Governor Healy and Lieutenant Governor Kim Driscoll. We are the biggest secretariat, which includes Mass Health, and it includes Children and Families, it includes the Department of Public Health. There are 11 agencies within the secretariat, and our budget is close to $27 billion a year. Much of that is Mass Health. So the Healy-Driscoll administration is very committed to making Massachusetts a great place to grow up and to grow older together. So last year there was an increase from $12 to $14 per older adult that support the councils on aging, and there are tax savings for older adults and caregivers, whether it's through the senior circuit breaker tax credit, the property tax volunteer program, and the child care tax credit. Now, why did I put child care tax credit here? Your caregivers have children. So, and also professional caregivers have children. And so child care tax credits are important for affordability in a state that we know can be very expensive. There's also been digital equity, and I know that we've made investments in councils on aging so that hybrid programmings can occur and the equipment is in place, and also in some locations handheld equipment so that people can have access to telehealth at home, or they can do hybrid programming from home. And so, of course, there's also housing, and there is a bill that has been sent to the legislature so that we can rehabilitate old housing stock as well as increase the number of units across the state. We deliver our services to older adults through two very important sets of partners. The 350 councils on aging, you are one of them, and 27 aging services access points, or they're also called AAAs. So the councils on aging, you know what the councils on aging will do, and how their work is so important to help people live in the community. The aging services access points are really our regional partners, and these are the various regions. You see in Worcester County, you span 3 different ASAPs. And so the aging services access points are the points through which we provide home-based services. So whether those services are, I'll go through the services a little bit more later, and the services could be nutrition at home, home-delivered meals. They also provide home care, whether you need hands-on care, help with grocery shopping, help with laundry. They also help with, some people will need help with showering, and there are many, many levels of home care that can be provided. So let me talk to you about our priorities. We want to help people live long lives, long, healthy lives. And we want to apply an aging lens across all our state policies. And we want to ensure equitable access to all services. You already practice that here in Worcester very, very well. And we want operational excellence and the best-in-class workforce. I see it here. It is amazing. And it's not just at the local level, but we need to do it at the state level too. We have some points of pride in what we can do for folks. We serve 10 million meals a year. Isn't that amazing? 10 million meals a year. We help 65,000 people stay at home with home care. That's more than the number of people who are living in nursing homes. In fact, that's about twice the number. And by the way, of the 65,000, 20,000, 1/3, they qualify for nursing home levels of care. We provide it in the home, and they can choose, and they choose to stay home instead of in a nursing home. We're very, very, very proud of this work. And we also rely on volunteers. There are more than 17,000 volunteers who help us. Now, volunteering is a really great thing to do after retirement. because it gives you a sense of purpose. And so often I have heard folks tell me, you know, volunteering at my senior center is just so gratifying. I have a community, I have people to see, people are grateful for my work. Isn't that great? So I encourage folks to volunteer. There are over 200 cities and towns considered age and dementia friendly. And that's a holistic way in which we look at planning and we look at policies in each of these cities and towns. Worcester is age and dementia friendly. And you know, we see it here every day. I see it evidence with, you know, I see it here. And why not? I mean, we should make Massachusetts, every town should be a great place to grow up and to grow older together. So in terms of equitable access to services, we have an 800 number, which is the central number people call if they need services and want services, or if they have a question. My mother lives in Iowa. I'm thinking about having her move closer to me. Can you help me think about what is available? The person on the phone can talk to you about that. And it's available in more than 100 languages through a language line translator. And I think there are Spanish-speaking staff who are available. And we also provide home care skills training. We do it in multiple languages. One of the things that we need to plan for, that I need to plan for, is having enough people to provide care in-home to people when care is needed. And so we have a free course that is 65 hours of training. We make it available in multiple languages. People are certified to become home care workers, and they're certified then to work in our programs to provide care to you in the home. I consider it a profession, and we train folks as if it is, we train folks in the professional practices, anywhere from relationship management with family to real hands-on care, how to lift somebody and help somebody without hurting yourself. So operational excellence and best-in-the-class workforce, it's a challenge because state salaries are not the same as private sector salaries, but we work really hard at it, and I'm really proud of the group that we have working in the profession and working within our state agency. People come because they're mission driven, and I want people to come because they want to do it in their hearts. All right, so this is just a graphic about the programs we have. I'm going to go through them relatively quickly and leave some time for you to ask questions. So we have there's a SHINE program. I'm sure it's available here. Provides you with Medicare counseling. Every year you have to sign up for Medicare. Every year some things change, and your SHINE counselor is our state-trained counselor who has no other agenda. They do not get they don't get a bonus. They don't get money because they steer people in one direction or another. It's none of that. They sit with individuals and do what's best, help you find the most economical approach to your situation. We have a prescription advantage plan. It's what I call the payer of last resort for people who fall into the donut hole for prescriptions. So it helps if you fall into a donut hole, and based on income, we can provide monies to supplement your prescriptions so that the prescriptions are more affordable. There's a senior community service employment program where we subsidize wages for 2 years to help people train for jobs that are more permanent jobs. And this program is meant for individuals who are age 55 and older and who are lower income. We know it's very difficult to find a job if you are unemployed after age 55. And so this is meant to be an incentive for employers to bring somebody on, help train, and then hopefully that person in 2 years graduates to full-time permanent employment. And then there's also money management for help in paying. As we get older, it can be difficult to, keep track of the bills and how, paying on time. We do have a service that's based in the regions, the ASAPs, that can help people stay on time in paying their bills, because that helps maintain residency in the community. It prevents evictions, and it just keeps everything going smoothly. Not all of us have a caregiver who can help do that. So for people who are truly alone, we can do that for you. So regarding the neighborhood and the physical environment, in housing, there are two types of support that we provide. One is what we call congregate housing, which is an individual lease for a room, and there are shared, you might share a bathroom, you definitely share a kitchen. It's sometimes in a house, it's sometimes in something bigger. So that's congregate housing. And we also provide supportive housing, which is a person on site who can help coordinate benefits, who can help coordinate transportation, who can help coordinate bringing the home delivered meals, somebody who is on site to help individuals. There's a call button, and then that call button goes to a service that is available 24/7. And of course, we've talked about the age and dementia-friendly efforts and transportation that I know some of you take advantage of. We also regulate assisted living residences, and there are 270 of them across Massachusetts. And we provide education so that we can help you make an informed choice. At the end of the day, we want you to choose how and where you want to age. And we want to provide you the information so that you can make an informed choice. And there are a number of different programs through which we can do this. And I want to talk about protective services. This is not visible to most people, but when there is a suspicion of fraud, abuse, or neglect, that suspected situation is reported to us through what we call mandated reporters. And mandated reporters are everybody who works here at the COA, at the senior center. They're in your healthcare institutions. They are, the police are, emergency workers are, the health department here. Mandated reporters will call in situations. We get 50,000 a year. Now I say that's not enough. I know there's more going on. And I want to encourage people to report rather than not report. We then investigate. This thing has wheels. Don't lean on the, that's a falls risk. We then, our department investigates the cases, and we substantiate 10,000 of those cases a year. And I say that's too many. These are very, very sad situations where there's substantiated abuse, neglect, fraud. We then help the older person, and we case manage the situation so that that person is in a safer situation, and we help the person reduce the risk of future abuse. It's very important work, and the people we help are among the most unseen in our society. And so if you suspect that somebody is a victim of fraud, abuse, or neglect, please do report, because you could be saving a life, you're helping somebody be seen, and you're protecting somebody who feels unsafe. I've talked about our home care program. There's also an ombudsman. And this is largely for people who live in nursing homes and assisted living. There's an ombudsman who comes in, works with the individual. Sometimes it's a dispute with the management, and sometimes it's a family situation. There are a number of different reasons, but this is a state and federally funded ombudsman.